Could be the testing's, frankly, overrated. Maybe it is overrated. But whatever they start yelling, we want more, we want more. You know, they always say, we want more, because they don't want to give you credit. Then we do more, and they say, we want more. But we have the greatest testing in the world. And don't forget, we have more cases than anybody in the world. But why? Because we do more testing. When you test, you have a case. When you test, you find something is wrong with people. If we didn't do any testing, we would have very few cases. They don't want to write that. It's common sense.
I just have to point out that the president talking about they saying we want more. Are you talking about the American people who want more tests so they can map out and understand where this virus is? Because it sounds like you're talking about a bunch of babies who want pie. I mean, this is the lack of understanding from this president and the lack of empathy, but most importantly, the lack of understanding as to what is needed in the United States of America to save lives and to stave off this pandemic, which is killing people by the day, is consistently staggering. Joining us now, the director of the Harvard Global Health Institute, Dr. Ashish Jha. He's a practicing physician and also a professor of medicine at the Harvard Medical School. I feel silly to ask you to comment on this, but there is a sense among the president that if you have testing, then you have more cases. And why would that be a bad thing? Dr. Jha.
Yes, good morning, Mika. So we're going to have cases either way, right? Testing doesn't give you cases. The virus gives you cases.
Right.
What testing does is it lets you identify who's infected. And then if you trace their contacts and you isolate people who are infected, it lets you slow down the outbreak. This is, again, outbreak 101, right? Disease outbreak 101. So testing doesn't cause cases. The virus is doing that. But testing is really helpful in identifying and isolating those cases so other people don't get infected.
Hey, Dr. Jha, it's Willie. You testified actually at a congressional hearing. You talked about the importance of testing. You said it's the cornerstone of our approach here for us to get our arms around it. And some Republican members on that panel said you were being partisan by saying testing is important. How did you take that criticism? What did you understand that to mean?
Yeah, so I was a little puzzled by it, Willie, because, again, I don't know any public health person, any physician, anybody who's at all knowledgeable about this who thinks testing is not important. The White House thinks it's important, right, because they're testing their folks every day. So I was a little puzzled. I think they saw it as a critique of the White House. I was saying that we have not had the kind of testing response we need to keep the American people safe, and it has contributed to shutting down the American economy. I think that's just common sense. My sense is that pretty much everybody agrees with that. So I was puzzled that it was somehow partisan.
As you say, that comes directly from the White House task force as well, that testing is important, Drs. Fauci and Birx among them. We got the new CDC guidelines out yesterday, Dr. Jha, a pared down version of the CDC's original 63-page proposal, very broad and leaving everything open to the states. As you read through those, how do you interpret them, and how should a governor, how should a municipality, how should the principal of a school, for example, interpret that?
Yeah, what was disappointing about the latest thing out of the CDC, there's nothing wrong with it. It's really vague, it's really broad, and it's not really an actionable plan. And again, I don't know why it's important to prevent the American people from benefiting from the expertise of the CDC. The initial 63-page report was really good. It was detailed. It talked to restaurants and bars and schools about what to do and exactly how to implement opening. If we all want to open up our economy, which we do, then those detailed guidelines are really helpful. These 6 pages, they're fine, but they're not nearly enough.
David Ignatius has a question. David?
Dr. Jha, I want to ask you a question that I think so many of our viewers are wondering about, and that is, how soon do you think therapies, vaccines, the kinds of medical breakthroughs that will make this pandemic manageable, will allow us greater comfort in reopening our economy, how soon do you think those will begin to be available?
Yeah, so David, I'm on the optimistic side of things when I look at around and look at other experts and what do people think. I'm on the very optimistic side, and my belief is that we'll have a lot more therapies by the fall. Certain late summer, early fall, we'll start having more treatments. We've got one right now that seems to work in really sick people. The vaccine, it's very hard for me to see how we have one this calendar year in 2020, but I'm hopeful, and it's really about, keeping my fingers crossed here, that we'll have one in early 2021, and maybe by mid-2021 it'll be widely available, because you got to ramp up and produce hundreds of millions of doses. So if everything goes well, next year at some point we should have a vaccine that's safe and effective.
Dr. Jha, I'm curious about masking. If the entire population did it, would it help keep the virus from spreading? I mean, there is an understanding that the droplets usually come from one's mouth. There's other ways, but they stay in the air for quite some time, and that masking could protect. If you're wearing a mask, you're protecting other people from yourself. And once again, we had a situation yesterday where we watched the president walking around a plant in Pennsylvania, and everyone was wearing a mask. He was not. He was definitely close to people. He was not 6 feet away. I know he claims that he takes this rapid test every day, and as a result, he doesn't have it. There he is, kind of focusing his droplets toward people. Is it possible that he absolutely, positively does not have it? But back to masking, how effective is it if everyone does it?
Yeah, so this is one where I have changed my views in the last 6 weeks as the science has changed. And the science really is changing on this. And more every day, we're seeing evidence that masking is very important. And if there was universal masking, if all people, when they were outside, wore masks, it could substantially decrease the transmission of the disease, and it could actually potentially even substantially decrease the severity of the disease people get, because the size of the kind of inoculum, the droplets that you inhale, may end up making a big difference in how sick you get. So I have really now come to believe that the evidence is pointing pretty clearly towards universal masking, and it'd be great if our political leaders followed that and model that behavior, because when they model it, other people feel more comfortable doing it. So I'd like to see all of our political leaders do that much more often.
Dr. Ashish Jha, thank you very much for your candor and your expertise. We really appreciate your coming on this morning. And coming up, Ron Klain coordinated the U.S. response to Ebola. Now he's weighing in on America's fight against COVID-19. The former Obama advisor joins us straight ahead. Plus, President Trump is pushing Obamagate in the middle of a pandemic. But records failed to back up his claims about his predecessor. NBC's Carol Lee joins us with that new reporting. Morning Joe will be right back.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.